So is there some central group that organizes your data?
So yes, there's really three groups. There's the new International Society for Neurovascular Disease. That was created by Mark Hakey. That's the one that Zamboni is the first president of. First annual meeting will be in Italy in the spring. Then there are these two nonprofit foundations. One's called CCSVI Alliance and the other one's called CCSVI Foundation. And then our data is collected by a data management PhD based in Colorado. We use the validated instruments. The MSIS-29 is a validated MS instrument. Every patient takes it before, at 1, 6, and 12 months. This data is being collected in an honorable way. The only thing that we're not doing is the placebo control, and I just can't see any way to do it. Well, maybe it's the key, but I'm not going to say to my son or to any of these patients that we're going to give you a fake one. We're going to do a sham on you. Great.
But isn't that how the scientific community makes sure that what they're doing actually works?
Yes, but that is a 10 to 15-year process. It's got to start somewhere. Somebody actually gave the first patient digitalis back in the 1800s. But somebody's got to do it first.
But if you don't know that this is factually working, if you don't know that this treatment actually helps somebody with MS, how can you continue to administer it?
Because every patient is saying they're better, except for two. Two have said they're unimproved or maybe somewhat worse. The rest of them, and now we're not just talking a day later, we're talking now 6 months later, they say it's helping. The data have to be collected. But
how do you explain the two? How do you explain? I mean, if
so far, I think there's so everyone's talking about this, including the new society. But I think there's two easy answers. If you've had severe MS for many years, those neurons are dead. They're not going to come back with any kind of magic treatment. The vascular symptoms, sounds right that they get better, right? The cold extremities, the fog, the headaches. That figures they get better. Then there's that group in the middle where their neurological symptoms get better too. Most of them are reporting some improvement of their neurological symptoms. So that could be subjective. It also could be placebo, but it's still after months and months. I don't think so.
Well, people call this a placebo effect. How do you explain that? But you kind of have said
not people. 3 neurologists have called it a placebo effect. In general, the placebo. First of all, the drugs are approximately 30% effective. That's considered to be the placebo rate. That any treatment you give someone, because they want it to help or whatever, about 30% of people will report an improvement. So people have actually suggested that the MS drugs that have been FDA approved may be a placebo effect. So it's possible. To me, it's not possible.
But those drugs have gone through a double-blind study.
That's right.
And your treatment is not.
That's correct. I see no way. I am not going to do sham venoplasty. The University of Buffalo and Stanford are talking about doing such a trial. I think they are having trouble funding it. Who's going to pay for that? Right? A patient's not going to pay. I think so. I would not want to have a patient pay for a sham procedure. So who's going to pay for it?
But how do you know they're not paying for a sham procedure if you never do the test?
I think it needs to be done. It needs to be done. I don't see that as my job. I think my job is to collect data, try to get more data on this. Let the Stanford, let University of Buffalo. They should be the ones to do. I'm not in any position to be doing sham procedures. First of all, I don't do the procedure, right? I do the MRI side of it.
If your son wasn't in the position he's in, and if you weren't an obviously concerned and caring father, I think people would question, how much money are you making doing this?
Yeah, I mean, I'll be even more blunt about it. I would not be doing this. I was doing.
If not for your son, you wouldn't be doing this.
I would not. I would know nothing about MS. Basically, I'm well trained. I was the chief resident at Einstein, one of the best programs in the country. But I moved into another area, drug studies, other areas, pain, this new neuromarketing stuff. So if Devin had not been diagnosed, I would know nothing about that. But as it is, it was clear to me that the theories and treatments for MS were ineffective and unproven. This theory makes sense to me. I had no idea. I can remember exactly where I was when the IR, the interventional catheter guy, called me up. I was fully expecting, and he told me himself, he was fully expecting for there to be nothing wrong. So when he called me up, he was shocked, I was shocked. And so at that point, I've helped my son. It makes sense to me, the theory of it. He's clearly better. Now, do I just drop it and say, well, I got my son covered? The family, we sort of had an agreement between us that I would get him treated first because everyone was scared about being shut down. The IRs were afraid the neurologists were going to prevent them from doing it. So I said, look, I'll get you treated first, but then I will do everything I can to help others get treated as well. So I didn't need to, but I went to the hospital and got their IRB approval to keep going, not just Devin, but others. So now we've done 50 of them.
Are you the only one in the area doing this? Are you?
I'm the only one in the United States.
You're it.
Yeah. I have created this multi-center registry, but I'm not actually part of it. So that's going to be done in different places around the country.
So do people come from all over the country to see you?
And Canada. Yeah.
So all over the world.
I don't know that we've seen anyone from Europe. Well, now we're being asked to see failures. So we're kind of the lead right now. So the guy at Stanford, Dake, he has a patient sent to him from, I think, Bulgaria that's so ill that he feels the patient can't wait to be treated because he has not got IRB approval yet and maybe won't. So he called us up, and the patient's going to be transferred down to us. So we're seeing this patient next week.
From Bulgaria?
I think it's from Bulgaria. Well, not from Bulgaria. It was treated in Bulgaria.
Oh, okay.
So I'm thinking Canadian.
So people from all over the country come to see you?
Yes.
That's accurate to say, and Canada?
Yes. I go, I think 90% are not in San Diego.
Okay. And you it costs roughly $10,000 per patient.
Yeah, so we're totally separate facilities. We charge $3,500 for the MR.
And that is this?
Yes, that would be an example of a venogram picture.
And so you look at that and you're able to see, are your veins clogged?
Yes.
And then you send them to somebody else who will unclog them.
That's correct.
And that's it. That's how it works.
That's how it works.
Okay.
Right. So, and then in general, insurance, these are standard MRIs. Insurance has in general been paying for them. And then when they go over to the IRs over in Pomerado Hospital, they are charging their standard fee, and in general, insurance is paying that standard fee.